So DBS stands for Deep Brain Stimulation. People sometimes compare this to a pacemaker, but for the brain. It's a system that delivers very targeted electrical impulses to the brain to interrupt the abnormal brain rhythms that occur in different neurologic disorders. So a DBS system consists of two parts. There's a thin wire, it's a little more than 1 millimeter wide, that goes into the brain from the top of the head. The brain electrode in a DBS system travels from the top of the head, underneath the skin, down behind the ear, and down to the chest where it's connected to a battery pack. The DBS pulse generator or battery pack sits on one side of the chest, underneath the skin just beneath the collarbone. I'm often asked whether DBS is experimental. I think it's important to know that DBS has actually been used in the United States for over 20 years. And fortunately, we have more randomized controlled trials, which are the gold standard in medicine, for DBS than for almost anything else in neurosurgery. So it is a safe and established therapy. DBS has come a long way in the last 20 years. We now have new surgical targets that allow us to treat different neurologic disorders, and we also have new implants and hardware. At Swedish Medical Center, I implant DBS with a state-of-the-art ROSA robot. This is a new surgical robot that allows us to perform the surgery accurately and in a more efficient way so that patients spend less time in the operating room. The robot is an exciting tool, but one of the common misconceptions that patients have is that surgery is actually performed by the robot rather than the surgeon. In fact, the robot is a tool that the surgeon uses to introduce the electrodes with millimeter accuracy. It's much more reproducible than some of the methods we used previously. The benefits of DBS depend on the disorder that we're treating. In Parkinson's disease, for example, patients enjoy better function in terms of their activities of daily living. They tend to have about 4 or 5 extra hours of good motor function per day. DBS also improves some of the motor functions in Parkinson's disease that don't always respond to medicines, things like tremor and dystonia. In the case of essential tremor, our rule of thumb is that DBS is able to reduce the severity of a patient's tremor by about 80 to 90% in at least 80 to 90% of patients. In epilepsy, long-term studies of patients undergoing DBS suggest that the average patient sees about a 70% reduction in seizures over time. One commonality between all of the disorders that we treat with DBS is that patients over time report a better quality of life. DBS surgery can be life-changing for the right patient. This is really what led me to become a functional neurosurgeon. The biggest barrier nowadays is that most patients who would be eligible for DBS never learn that it's an option for them. And that's what we're hoping to change with the webinars, patient group meetings, and videos like this one to help get the word out there about this therapy.